Week 7 of Aon's Public Affairs podcast was recorded May 20th, 2020.
Hello and welcome to the Aon's Public Affairs podcast, Week 7. Daniel Sirota from the Public Affairs Office in Chicago. I am excited to be joined today by Violeta Ostafin from Aon Health Solutions in Latin America, the CEO of our business. Violeta, welcome to the podcast.
Hi, Daniel. Thanks for having me.
Violeta, let's dig in. Interesting times we live in. A lot of stuff is happening across the globe around this pandemic of COVID. Wanted to kind of dig in on some of the regulatory changes you are seeing. Specifically, we can start with Mexico and Brazil on, big picture of things that are happening across the board.
Yeah, certainly. It's been interesting times, to say the least, as we all monitor the pandemic and how it's been evolving. Latin America, I think what we'd like to say is we're around the fourth wave of how the pandemic has spread and how we've been seeing infection rates in our different countries. Every country's in a different situation. If we look at Brazil, for example, and specifically on the regulatory changes, we're now in Brazil the third most infected country in the world, surpassed most recently. In Sao Paulo state, we have the more infections today than we did in China, or we do in China, and in Mexico, comparing to another Latin American market. And on some of the regulatory front, I'll highlight a couple of points, but it's really been around the health side of things, on how the health agency and the Ministry of Health have looked to coverage on the test for COVID testing, and also how they've given some reprieve in terms of how we are looking at the periods for elective procedures, some reprieve for being able to conduct medicine in a different way. So I would say a positive coming out of this crisis is that we've been able to do digital prescriptions. We've been able to do some of the telehealth, telemedicine, and really advance that, as it's a need during the crisis right now.
I would love to try to dig in a little bit further on the telehealth, because I think, we are going to this new normal of what, this is going to look like. What are you hearing from employers as they start evolving and looking at telehealth as kind of a new normal?
So it's important to say it remains to be seen how the suspension or the approval of the use of some of these procedures in telemedicine is going to continue post-COVID, as it really has been in order to give some relief to the health systems during this time period. So that remains a question mark. But from an employer standpoint, I could say, and I'll comment using the Brazil example, that it's been relatively positive response in that employers are interested in providing what's the best access to care for their employees. So it's really the employees and the need and how to best serve them that's been driving an interest to be able to provide access and understand how that coverage works. And, I'll use an example. There's something that we had made available in some of our markets in Latin America on this telehealth side, is more of a hotline in terms of navigating the COVID and understanding that there was a higher demand that employees were having. And so we provided that as a part of our health offer and our health and benefits for existing clients. And the response was quite positive. The volumes of demand were pretty high as well. They'll probably taper off over time as things stabilize, as we move through sort of the react phase and the respond phase, and then get into a more balanced use of these types of resources.
That totally makes sense. As we start talking about the new normal, about how to give best quality care to, employees. I mean, it's great that our employers are thinking about that. When you talk about regulatory changes, talked about the health side of it, what has the stay-at-home orders been more broadly? Has there been, in Illinois today, Governor Pritzker announced that phase 3 of the reopenings, where they're going to start having outdoor restaurants, activities. I'm excited. I'll finally be able to get a haircut. Things like that are starting to reopen. Is there a line of sight into how that's shaping in Latin America more broadly? How is that going?
There is. And again, it's a mix, given we have such a diversity of markets. So maybe I'll pick on our two largest markets, Brazil and Mexico. So in Brazil, there isn't a federal or a strict stay-at-home order from the federal government. It's really been more of a municipality or statewide, I guess similar to the United States, view of things. Since we are still at peak infection rates right now, or nearing peak, I think depending on how you look at it or who we ask. There are some places that have more strict orders in place, formally lockdowns. Take the state of Rio de Janeiro, and in particular, a part of Rio called Niterói. In Niterói, there are specific lockdowns with penalties, and that's still extended for the time period. In other parts of the country, I'll take São Paulo, where there's a high concentration of infection. There's been an extension of the time period and guidance in order to more of what would be a shelter in place, although that's not the official language used for it, and recommendations on use of masks. There have been recently requests to put holidays earlier so that people would stay at home for a bit longer through end of May. And then there's states such as the south of Brazil where the incidence rates have been lower, and that's where things are progressing, really a slow reopening that's been happening and moving in a pace, given that there haven't been as much of an impact from the COVID-19. When you look at Mexico at a federal level, they've actually implemented a stoplight approach driven by the federal government and a broader definition of what some of the essential businesses like mining and construction that as of June 1st can start to operate. But given the stoplight approach based on different geographies within the country, it will determine which parts of society, essentially, businesses, economy, social, will be able to reopen. So it's really a mixed bag, I would say, but it is driven in large part by the level of impact and the level of infection rates that the different governments have seen.
And within that, I'm assuming testing, screenings, you name it, is becoming a big part of kind of how they're getting out there. How has that process been going from your perspective, overall? Has that driven a lot of movement? Has that been something that, you're seeing now that we've been through this for, I'm losing track of the countdown, but for a long time, is that something that you're now seeing that this is not becoming a problem as much?
So testing and the whole concept of how testing is being used has been a bit of a debate, I would say, around the different countries. When we look at in Brazil, and I think here Brazil and Mexico, again, to use those two examples, Brazil and Mexico are probably in the same camp, which is around really testing for the most severe cases. Mexico, despite moving to a reopening and this June 1st date that was placed, has also stated that they won't be doing mass testing and only if somebody presents the most severe symptoms. In Brazil, the test, which is the one that's mandated as an offer and reimbursed under guidelines of coverage, was originally in the emergency room setting, and that's that RT-PCR test. And so we still believe that the rates of testing in Mexico, in Brazil, are low. If you compare the rates of testing with United States, that's taken a different philosophy on the need and the importance of it. I think it's something of a difference is around 30 times how much less testing is being done in these largest geographies in the region.
Yeah, I can't believe it. And it's something that we are seeing in the US as well, a similar, understanding of this more broadly too around testing and screening. I kind of want to switch a little bit of some gears and dig a little bit further on the return to work. It's been a conversation in the US now that more of these phases are coming and states are being more engaged on how this may look like. Would love to get a sense of, how is that being looked at in Latin America? And, if you could talk a little bit about the Aon perspective, that would be great as well.
Certainly. So I think what we commented on earlier, which was the really being driven by where do you have lower incidence rates and what's some of the guidance from the federal government or from particular states on the return to work. I think that's the driving guidance toward how we're starting to look to how we return, how we prepare for return and what we do. But commenting on the Aon side, and given that we work with many employers around these different geographies and helping them to prepare both for a safe workplace as well as in best understanding how they have their employee safety and in their employee health within with this entire situation. I would say that employers are asking themselves around the question of how do I start to think about everything from do I need to do some sort of a screening? This is where Aon has come in and helped to guide questions around or driven by our employee impact model, which is analytics about how might this pandemic or how might this infection spread within my workforce, and how might I plan in terms of waves of my workforce that come back when, where, and of course, planning for the fact that some of this might be waves or might be cyclical. There's an entire picture here that we're seeing with employers of an interest in having the right tools, protocols, guidance, almost checklist of what they need to do when they think about their employees interactions with others, with clients, with vendors, with outside partners, the workspace itself, and what we do, as we come back to, as you referenced, this new normal, and recognize that this new normal is also in some way going to be cyclical as things stabilize. There might be, as we've seen from other regions in the world, that there are reinfections, there are next waves, and we need to be prepared for that cycle and how to manage it. And employers are really asking about guidance around that in all respects.
And is this something that you are seeing, from Aon perspective, helping clients do that more broadly? Is there, in the US, it's something that we're having conversations with them every day. We need to be careful on the guidance from CDC, state regulatory, et cetera. But, what is Aon's role in this, and how are we helping our clients look at this more broadly?
Aon's come together globally, and we've pulled together a business recovery toolkit to really give an end-to-end on the set of the key issues reference for our clients of how they might think about or start to think about this issue. We've translated it and adapted it to specific environments. Every country has a slightly different question around some of these aspects, like regulatory, like the different timing of what you might do in different labor regulations. So we'll have that ready soon, and it's going to be available on Aon's site. And then our specialists within each market are going to be ready to consult around it and to really dig in more deeply on the question with our clients and with employers.
Yeah, and there's not a one size fit all, right? Every region's different. Everybody's going to have different guidance, and even every industry, right? When you think about it more broadly, and Aon's expertise as Aon United, working with all industries, kind of put it together in a toolkit. So that's great and exciting. Violetta, I want to say thank you for joining the podcast today. I appreciate your leadership. I appreciate talking to colleagues like yourself across the globe and everything you're doing for Aon. So thank you so much.
Thank you, Daniel. Thanks for having me, and hope everyone stays healthy.
Next week, we're going to be joined by Rick Jones, Senior Partner and National Practice Leader for the retirement space, to really dig in on the Secure Act. It's passed. PEPS is the new thing, and how this is going to be working even during a time of COVID. Please stay tuned to next week, and we look forward to having you join week 8. Thanks so much. Stay safe.
This information is a resource for Aon clients and business partners. It is intended to provide general guidance on potential exposures, and it is not intended to provide medical advice or address medical concerns or specific circumstances. Due to the dynamic nature of infectious diseases, Aon cannot be held liable for the guidance provided. We encourage visitors to seek additional safety and medical information from credible sources. Thank you.